Hello, it's Dr. Brandt Gibson, and today I'm going to talk to you about ankle fractures. As we talked about yesterday, we were talking about the foot fractures, and we really focused on the tarsals, metatarsals, and the phalanges, or the digits. Today, we'd like to talk really about ankle fractures, including in that, though, however, we're going to include the calcaneus and the talus, because those types of fractures are also notorious for being more difficult and harder to get repaired and so forth. And then you also can have fractures in the tibia and the fibula. So, to start out, let's start with the ankle fractures themselves. With an ankle fracture, there's a couple different things that can happen. You can have an ankle fracture of just the fibula, you can have an ankle fracture of just the tibia, or you can have an ankle fracture of both, or you can get what's called a trimalleolar fracture, which is the medial malleolus of the tibia, the lateral malleolus of the fibula, and then the posterior malleolus there of the tibia as well. So you basically get all three areas of fracture, and that's a lot more difficult, a lot bigger deal. So I'm going to be very generic and basic because the fractures of the ankle can be pretty complex and pretty difficult to heal. Most of the time, a good fracture of the ankle does require some form of treatment. If it's not displaced, it can usually be casted or put in a boot and non-weight bearing type situation typically. If it's displaced, it always requires a surgery of some type to keep your ankle stable. Same type of thing is going to happen if you were to have a fracture of the talus or a fracture of the calcaneus. Displaced fractures do need to be repaired. The other part of the talus is it's notorious for not healing well because of the circulation to that, whereas the calcaneus is notorious for healing very well. So it's the important part of this is going to someone that has significant experience with calcaneal fractures to make sure it is repaired anatomically to give you the best recovery and the best return to activity. The other things you worry about is anytime you're disrupting a joint, like the subtalar joint or the ankle joint, the repair is significantly more important because it will actually interfere more with what's going on with life. So if you have a pretty significant ankle fracture or a pretty significant talus or calcaneal fracture, you want to go to an individual that treats these on a regular basis so that you can actually get the repair that is necessary. As with other fractures, bones take 6 to 8 weeks to heal. Sometimes with a repair, it's going to take longer to allow you to weight bear, waiting for stability and so forth. A lot of times there's going to be hardware involved, and as long as the hardware doesn't bother you, you don't have to take it out at a later date either. So this is relatively generic, relatively simple. We need to go into significantly more depth to talk truly about a calcaneal fracture, a talus fracture, or the different types of ankle fractures. But I want to just give a generic information. Should be evaluated, should get an x-ray, and should get ideas of treatment, everything from protection to surgery. The other thing, anytime you get a sprain or fracture or anything like that, the typical thing you should think about is rest, ice, compression, elevation. The big thing, again, with fractures is protecting them enough that they don't move, they don't cause the fracture to get worse over time. This is Dr. Brandt Gibson, and this is your podiatry tip day 27, fractures of the ankle. Thank you. And I think tomorrow we start to talk about some of the things that can happen in the way you walk, some of the problems that can occur from how you walk. Again, this is Dr.